Good evening, everybody. I'm Professor Manokar from Chennai, a cardiologist. I'm here to discuss with you the impact of exercise with respect to cardiovascular diseases and how this has an impact on terms of outcomes, in terms of disease prevention and disease. So, I switch back to how to plan your exercise. And most important is any activity is better than none. So, there are two types of activities. One we call as strengthening activities, and another is what we call as moderate intensity exercise. And we'll discuss both of them separately in a very short fashion, so that we can discuss both the issues. Both are different. Strengthening exercise activities are different. Physical intensity activity are different. We'll come to that next. So basically, the UK recommendation says that plan it over 9 weeks. Every week, keep on uptitrating whatever you are doing to achieve what you want to achieve. That's the reason I copied this from there. Next. So the two things. So how do we achieve the target? Either you can plan it at several short sessions of very vigorous activities. Say somebody with say arthritis can say, I can walk 5 minutes max. So you can plan 5 minutes of very vigorous intense activity, or you can mix moderate, vigorous, or very vigorous activity. I'll tell you what I mean by moderate, what I mean by vigorous, and what I mean by very vigorous activity. But the target is what the American guidelines told: 5 days of 30 minutes at least of moderate intensity activity, or 150 minutes of in a week. So you can take 2 days off in a week. So this is very important. You can do your weekly target of a physical activity even on a single day, or over 2 or more days, whatever suits you. But the target is 150 minutes of moderate physical activity, and that has to be planned. And this we can even plan for disabled adults, even for pregnant women and new mothers. So the concept is every can do this kind of things. Next. So whether you have heart disease or you don't have heart disease, the recommendation is very clear: 150 minutes of moderate intensity aerobic activity, 75 minutes of vigorous intensity activity, and a mix of moderate. Precisely what I discussed in the previous. The why I put up this slide is whether you have or you don't have heart disease, this is what is recommended for people at high risk of cardiovascular disease. Next. So what do I mean by moderate physical activity? Moderate physical activity, how do you know whether it is moderate physical activity for you? What is moderate physical activity? Maybe a mild physical activity for somebody who is a runner. So what is a moderate physical activities? It should raise your heart rate. It should make you breathe faster and feel warmer. And these are the clues that you should look for. And the very simple way how to know whether you are doing a moderate intensity activity is you can continue to talk, but you can't sing. So, a very simple way to understand what do I mean by a moderate aerobic activity. That is, you can continue to talk, but you cannot sing. And what examples? Obviously, brisk walking, water aerobics, riding a bicycle, playing, doubles tennis, dancing. Very simple moderate activity. But remember this point that I mentioned. What I mean by moderate activities, it should make you breathe faster, feel warmer, and you can speak but not sing, and that gives you a fair understanding what I mean by a moderate physical activity. Next, what I mean by vigorous activity. So vigorous activity is something which makes you breathe faster, harder, and you will not be able to speak without taking a break. So that is what I mean by vigorous physical activity. That is, you can forget about singing. You cannot even speak without taking a pause or taking a breath, and that is what we mean by physical. So you not only breathe hard and fast, but you also have to pause. If you want to speak something, if you want to convey something, you have to pause or you have to take a break. In general, 75 minutes of vigorous activity is equal to 150 minutes of moderate activity. So the ratio you should understand: 75 minutes, 1:2. 1 minute of vigorous activity is equal to 2 minutes of moderate activity. What are the examples? Obviously, jogging, swimming, riding. These would be the examples. Next. What do I mean by very vigorous activity? This is what I mentioned in the beginning. This is not for normal people. This is for people who have very good exercise capacity. I wouldn't advise people with significant heart disease to even try these things. But this is because this is a meeting for common people. I'm just mentioning what I mean by maximum effort. The activity in which patient cannot do it and has to take small breaks. That's the simplest way. What I call as very vigorous activity or high intensity interval training. Basically going to a gym and weightlifting, circuit training, sprinting up the hills, interval running, running upstairs and spinning classes. Next. So this is the last part of my discussion. Many of my patients say, I do yoga, so no exercise, doctor. Please understand, yoga or any kind of muscle strengthening activity is not always an aerobic exercise. So this is on top of your exercise. So please never substitute yoga for physical training. Physical training is something different. Yoga is more of a muscle strengthening exercise or flexing or kind of that kind of exercise which helps stretching your muscles and those things. So please understand both are different. You can do activities that run on the same day or on different day, whatever is best for you. But muscle strengthening activities are not always aerobic, an aerobic activity. So this is on top of aerobic activity, and that's the point I wanted to stress. Next. So what I mean by strengthening activities or routine things like yoga, all these things, these kind of thing where you use exercise that you use your own body, simple things like push-up, kind of abdominal crunches. These kind of things are what we do and sit up. We use your own body. These are nothing but muscle strengthening exercises. Next. That concludes the discussion. Thank you.